I'm Mike Eggerstedt. I do facial plastic surgery and general ENT in Chicago and Aurora. So I'm fortunate. I was trained both in ENT as well as facial plastic surgery. So I treat sinus issues with nasal breathing, everything from ear, nose, and throat. I also have specialized training in facial reconstruction for skin cancers, for head and neck cancers, facial nerve reanimation, and then cosmetic facial surgery as well. Patients who come in and need rhinoplasty, want to change the appearance of their face, or want facial rejuvenation, I treat all those things equally. So I'm fortunate. I work with other ENTs in my office as well as audiologists. So we have audiology right there. It can really save patients from having to jump through hoops if I can just pop over and get some information for the audiologist or get them seen quickly with them. Additionally, me and my partners have different clinical interests, and so we really complement each other in terms of getting the right patient to the right doctor. My patient visits tend to be conversational in nature. I find if you give people the space, they can kind of lead you to what it is that can help them best. So that's how I arrive at really good outcomes for my patients. A couple of unique things that I offer in my practice include preservation rhinoplasty, where we don't need to make as many incisions or as big of an invasive procedure to get patients the cosmetic results that they'd like in rhinoplasty, as well as facial nerve reanimation, and we do that for patients with Bell's palsy or other causes of facial nerve paralysis. And finally, gender affirmation surgery. So for our transgender patients, we're providing a comprehensive care for that. Part of what got me interested in both ENT and facial plastic surgery is that I actually had facial fractures when I was in college. I met with an ENT and a facial plastic surgeon who took care of me. And so I've had a lot of patients that have been trauma patients that I've reconstructed throughout the years, and those are sometimes the most rewarding patients to work with. Because they come in, they need help, they need to be restored to both form and function, and if you do a good job for them, they're just the most grateful patient.